Hi, my name is Jennifer Viverka, and this is my demonstration video for initiating an IV. The first thing I'm going to do is I'm going to do my 6 rights of medication. I am going to make sure that I have the right patient, the right medication, the right time, the right dose, and the right route. And when I am done, I will make sure I have the correct documentation. I'm also going to perform the 3 checks throughout this process. The first check would be as I checked the orders from the physician. The second would be as I gather the medications, and the third will be before I give the medication to the patient. I am going to perform hand hygiene, gather all of my supplies, and then I am going to get 2 identifiers from my patient and see if my patient has any questions and explain what I am doing. And I will also put the bed at a good working height. So now that I've taken care of that, performing hand hygiene, I am going to take my solution. I'm going to make sure it's not expired and that it looks the way it should, that it's not cloudy, that there's not particles in it. I'm going to put a label on it. And the label will have the patient's name, the date, my initials, the time that the infusion begins, the rate, and the time that it is over. Then I'm going to get my tubing. And I am also going to put a date and a time on a label on my tubing. I'm going to lock the tubing before I begin. And then I am going to remove this cap, making sure not to touch the port, and I'm also going to remove the cap on the spike, also making sure not to touch the port. And then I'm going to hang this bag. Okay, then I'm going to fill this halfway. And then we will prime the tubing. Okay, and now that my tubing is primed, I am going to get a saline lock ready. And attach a saline flush and prime that as well. Now I'm ready to see my patient. With my patient, I am going to apply a tourniquet 4 to 6 inches above the IV site. And I'm going to ensure that I have a radial pulse. That will make sure that the tourniquet is not too tight. I am going to locate where I am going to insert my IV, and then I'm going to loosen the tourniquet. I will perform hand hygiene and apply clean gloves. And I'm going to take an alcohol swab I'm going to clean the site from the center out. And then I'm going to do that a second time. I'm going to allow that to dry completely. Tighten the tourniquet again. And then at this point, I'm going to let my patient leave. And use my patient in a bottle. Okay, so now that my tourniquet is on my patient, I am going to take my needle and catheter. I am going to hold the skin below the sides tight. On the bottle, I have to hold it over here though. I'm going to insert the needle. When I get a flash of blood, I'm going to bring it down to the level of the skin. And then I'm going to insert the catheter without pushing the needle any further. Then I will dispose of my needle in the sharps container and do a 5 milliliter saline flush. Then I should have done this before. I am going to secure my catheter with a chevron. And I'm going to apply a dressing. And I will label the dressing with my initials, the date, and the gauge of the needle. Then I am going to put a gauze pad here. Oh, and I would have cleaned this before I put the clear dressing down. Oops. And then I'm going to put tape to secure my saline lock. Now I'm ready to attach my IV. And then I will use a piece of tape to secure the tubing. And then I am ready to turn on my IV. Now for this one, my drop factor is 10 drops per milliliter. I got that off of the tubing package. And I am going to do 167 milliliters per hour because this patient is getting 1,000 milliliters over 6 hours. And then that comes to 28 drops a minute. So I will use my watch to make sure I get the correct flow rate, which should be 28 drops per minute. Then I'm going to check my IV site. I will clean up everything remove my gloves and perform hand hygiene. I will leave my patient in a safe, comfortable position, lower the bed, and make sure the call light is in reach. And then I will leave. And then shortly afterward, I will come back to check. I will ensure that we have the correct medication and that it's infusing at the correct rate. I will ensure that the IV site looks good, that there's no redness or swelling, that my patient doesn't have any pain. And I will continue to monitor it. Thank you.